Sawasdee krap. Good evening. Good afternoon. Today is Friday, the 18th of June, 2021, and this is the English language summary of the daily press briefing here at the Center for COVID Situation Administration, or CCSA. So as you know, we are here for you every weekdays now, Monday to Friday, and not anymore on weekends. However, you can still avail of the information available on social media, on the various pages and websites that are official. So I'd like to start off first with the vaccination update progress as we have every day. So to date now, we have inoculated 7.2 million doses already in the country. Now that's quite good progress compared to the dates that we have. We started the official inoculation on the 7th of June, which was just earlier this month, just actually 11 days ago only. And within 11 days, we have jumped the inoculation numbers to up to 7.2 million now. So with the rate that we are going, I believe that we can reach the 10 million doses in the month of June. And of course, likewise, in the months ahead, like July and the other months as well. And I'll go to a bit detail about the vaccines a bit later. First of all, numbers for today. New recoveries, we have 4,094. While new confirmed case, we have 3,058. So you can see that there are more recoveries than confirmed cases now. However, that's not the point, of course. We know that each number, each digit is a life. And we have over 32,000 active cases and cases still being treated in hospitals now. This number is actually on the decline. You can recall that we reached over 40,000 a few days ago. Now it's almost coming to 30,000 already. Unfortunately, we still have fatalities at 22 recorded for today, making the cumulative at 1,577. Bangkok has the highest number of fatalities, and one each from the provinces such as Nakhon Pathom, Ayutthaya, Cha Cheong Sao, Songkhla, Phrae, Phetchabun. And for today's fatalities, half were male and the other half are female. So today, one important piece of information that was summarized by Dr. Thuisin in the Thai language summary just now was about the general CCSA meeting that we had earlier this morning, and it just concluded just a few moments ago before this briefing began. So the Prime Minister presided over the general CCSA meeting this morning, and various issues were discussed and approved. Firstly, the vaccine drive, total of 6 million doses were procured as planned for the month of June, and inoculation would be reaching 10 million because of the vaccines we had earlier. And for the month of July, the Ministry of Public Health plans to acquire another 10 million doses of vaccines for July. And this 10 million doses will comprise of various vaccines, which would include AstraZeneca and Sinovac and other doses. It will comprise of AstraZeneca, perhaps around 5 to 10 million, and it will be filled with other vaccines such as Sinovac at 3 to 5 million as well. So the numbers might be fluctuating, but in terms of the total number, we aim to reach around 10 million vaccines acquired for the month of July. In terms of the distribution, Bangkok will be provided at 2.5 million doses in July, and Phuket will provide the second shot to about 70% of the population within July as well. So the progress in Phuket is quite good. That's why we are confident about the opening of the pilot program in Phuket on the 1st of July. Now, in the general picture, the Ministry of Public Health has proposed in the CCSA meeting this morning and has been approved about the acquiring of a total of 150 million doses by 2022 of vaccines. Now, previously, it was planned for 100 million by 2021. Now, this increase of 50 million will make it 150 million doses total by 2022. And if you do the math, this actually exceeds the number of doses required for the entire population of the country. So we will be able to inoculate 75 million people, because one person needs 2 doses, so 150 million doses would be for 75 million people, which far exceeds the number of the people living in the country. Now, another issue that was talked about in the CCSA meeting this morning, the general meeting, was about quarantine management, that starting from the 1st of July, all Thai nationals will have to undergo quarantine in the AQ, or alternative quarantine system. Now, if you recall previously, Thai nationals who came back from abroad were required to go into the SQ or AQ. So SQ, that would be, the cost would be shouldered by the government for Thai nationals in the SQ. And if the Thai nationals chose to go to the AQ, they would have to bear the cost. That would be at the other the hotels, for example. But of course, for foreign nationals, the requirement since the beginning was ASQ or AQ, where the cost would have to be shouldered by the passenger coming in. Now, so on the 1st of July, however, all Thai nationals will have to undergo quarantine at the AQ, because of course the emergency need to come back, be repatriated from abroad, is now not the case anymore. Usually when Thai nationals go abroad these days and come back, of course, that would be a reason for them to have to shoulder their own costs for the AQ, within the AQ, and not in the SQ anymore. So that will be taken away. But however, for COVID tests for Thai nationals during the quarantine will be subsidized by the government. The CCSA meeting also further agreed to ease restrictions and preventive measures across the country, starting this coming Monday, which is the 21st of June 2021. Especially for restaurants and convenience stores, you have a map on screen there for you, so there will be some readjustment of the zoning as well for each province. You see that most of the provinces above north of Bangkok is colored yellow, which is actually the lowest tier, the lowest group, with the highest number of provinces, of course. So that means that the situation is very good. And you see dark red only concentrated in the Bangkok area. So this will be a realignment, and this will start on the 21st of June. There will also be other measures regarding restaurants, regarding use of certain facilities and businesses, all throughout for the whole country. The details are being finalized and will be publicized soon via the Royal Gazette. And we'll talk about that perhaps Monday, this coming Monday, when it is officially announced. Now, just talking about the Phuket sandbox, which Dr. Thuisin touched upon just now, that's on track to be launched on the 1st of July 2021 as planned. The details of how the scheme will be carried out will also be ironed out and informed in due course. But basically, this pilot project is to prepare the country to be fully opened. As you know, in the news yesterday, the Prime Minister announced that we target to open the country within 120 days. So there must be a start. We have to start somewhere. We're starting with Phuket as the pilot province. The Ministry of Public Health suggested for this scheme, opening up of the pilot province and then in due course other provinces, for this to work, the following should be set up and prepared. Number one, an operations center set up to monitor local COVID-19 situation. Number two, local people must be informed and prepared. Their feedback, their concerns must be taken into account. Number three, preventive measures must be implemented thoroughly to prevent the outbreak and ensure the safety of local residents. Now, for Phuket in particular, the CCSA meeting also talked about the contingency plan in case any unforward incident happens, if the situation is not controllable as soon as the province is opened. So just in layman's terms, I can say that whatever is open can still be closed. Of course, whatever adjustments that we have to make, we will have to make it. But if all goes well and Phuket opens on the 1st of July and nothing unexpected happens and the schemes, the enforcement, the control is problem free basically, and the tourists are able to come and enjoy Phuket coming from abroad and enjoying Phuket without having to quarantine in a hotel, but sort of like a pseudo quarantine within the province itself. But it's a very good kind of quarantine, of course, because for 14 days you'll be quarantined in the entire province. So therefore you can visit the province of Phuket during the 14 days, the first 14 days that you are there. So the contingency plan is being prepared for that, and hopefully that when we open Phuket, we would not have to make any drastic changes or close the province once again. But in any case, we'll be prepared for any emergency situation. Now, if Phuket works well, other provinces will follow suit, will follow in due course. For example, Surat Thani province with Got Phangan, Samui, Got Tau, those beautiful locations and islands. This province was also discussed today in the meeting that we had along with Phuket. But in terms of timeline, it will probably follow Phuket in due course. The details are kind of similar to Phuket, but with slight differences in terms of implementation. The CCSA also endorsed that for health preventive measures to be expanded for film crew and TV production. Now, we talked about this yesterday, and I'll just put up some more details today. This includes the limiting of the number of people on set to no more than 50 people, and close contact scenes should also be avoided. Presenters in these TV production, the actors, must also continue to wear masks during filming, except when actors are on set and contestants in singing contests, of course, but of course with the appropriate social distancing measures. Another piece of information regarding a neighboring country of Thailand, Lao PDR, about Pfizer vaccine shots in Lao PDR. The Lao PDR government issued an announcement that Laotian and foreign nationals who fall under set criteria of being over 60, working in the front lines or in high-risk locations, or have chronic diseases such as high blood pressure and diabetes, must present relevant documents such as work certificate or medical records to show their eligibility for vaccination in the Lao PDR. They'll be able to apply for Pfizer vaccine jab in the Lao PDR. But I mention this because it is very important to note that this does not cover travelers from outside the Lao PDR traveling into the Lao PDR, and of course those not including those who travel just for the purpose of being vaccinated, and also for leisure or short business purposes. It is for those foreign nationals, Thai or foreign nationals, who already reside in the Lao PDR. And you see on screen, this is an announcement of the Royal Thai Embassy in Vientiane, the Lao PDR, to provide this information in Thai for Thai nationals who may have misunderstood that they can travel to Lao PDR and get the vaccine shot. That's not true. It's only for expats and foreigners of any nationality who already reside in Lao PDR. And I mention this because it would be useful for non-Thai foreign nationals in Thailand who may have heard about this information as well. So, last slide I have today is from the World Health Organization. It has been made to encourage everyone about the first vaccination shot as soon as possible, as it will prevent infections and from severe and any untoward incident, any unexpected side effects, and prevent fatality. Of course, prevention is best to start with. It starts with us. So if we're determined to protect ourselves from being infected, we'd have to also work to prevent others from the disease as well. So please remain vigilant, and even after being vaccinated, it's important to continue to not be complacent and remain vigilant and remain very strict in terms of the implementation of all measures, abiding by all the enforcement measures. So thank you very much for your kind attention today. I hope you have a very, very happy weekend. We're in the middle towards almost the moving forward to the end of June. We hope that our plans will work with your continued cooperation thus far. Now it's been around 6 months since the cluster in December, and it's been a few months since Songkran already. But we hope that time will not be a factor. I hope that it will not be an obstacle for us to continue our cooperation, our strong cooperation, all sectors of society, all nationalities, to fight COVID off once and for all. So thank you for your attention, and we'll see you Monday. สวัสดีครับ